Yes, no, thank you very much. And this is, and then just before I start, most of the work I'm going to be presenting here has been written by Ian Semenza. So he's essentially written the literature on climate change and infectious diseases in Europe and across the world. So the presentation you'll see today is based on the first ever European climate risk assessment, EUCRA, where I had the privilege to lead the health risk assessment along with Jan Semenza, Joachim Rockloff, Professor Elizabeth Robinson, and several other colleagues from all over Europe. And this UCRA was mandated by the European Parliament to, as you will see in a little bit, to contribute to policies in different time horizons in Europe. Um, Moving on. So Ian has already said this several times, I'm guessing. Climate change affects several aspects of our planet, including the environment, the labor force, the economy, and of course, human health. We are experiencing our health being increasingly affected by climate change, right? Um, and so different impacts, such as increasing food insecurity, extreme heat exposure, drought, and wildfires. And of course, a heightened risk of infectious disease outbreaks. They are all due to climate change. Um, and then, of course, climate change affects human health in multiple and complex ways, and we're not sure if we understand all this, all these transmission channels well enough, which sort of prevents us from effective policymaking. Um, EUCRA was mandated, as I said, by the European Parliament to support the identification of policy priorities related to climate change adaptation and policy development, especially for the climate sensitive sectors. And this started in the previous policy cycle, both for European and national level policies. So we're also going to be involved in the next version of EUCRA and contribute to the next European Parliament policy challenges. And we have tried to focus on risks for Europe caused and aggravated by human-caused climate change, but also we have tried to consider non-climatic drivers, as you will see in a little bit. The whole report identified 36 major climate risks for Europe. And many of the risks, as you will see in the next slide, have not been discussed in detail in the context of policymaking under a changing climate. Well, we as a group also try to highlight urgency of addressing these risks by considering both severity of risks in different policy horizons, as I'll discuss in a little bit, and of course, policy characteristics. Now, this is a very heavy graph, as you can see, but this shows the different policy clusters that was identified in the report in the form of ecosystems, food production and access to food, health, which is what we led along Ian and myself, infrastructure, economy, and finance. And as you can see, the purple is where risks are severe, and at the same time, this is where urgent policy actions are needed. And then moving down along the line. But as you can see that there are several areas across these clusters that pose high risk for Europe and at the same time require urgent policy actions. And many of these clusters or subclusters, as you will notice, have so far only been talked about briefly, and not a lot of policy actually exists, even in Europe, to address these challenges. Europe, as we have often, tried to say that our infrastructure is all right, but not a lot of our infrastructure is actually climate resilient, and that increasingly poses a challenge in this fast and extreme changing climate. It's too much information to go through in the short amount of time I have, but we'll go through in detail through the health risk urgency later on. Europe is the world's fastest warming region, as you can see on the left side figure. But it's not just temperature or temperature increasing, average temperature increasing. Hazards have increased across Europe, whether we talk about heat wave days or total precipitation, heavy precipitation, droughts. They are mostly on the rise across the European regions, whether we talk about Northern Europe, Western Europe, the central regions, Southern Europe, and Southern Europe across, not just in health, but over and over again, comes up as a hotspot where it has several areas at risk, but at the same time, policy is often inadequate to address these challenges. Um, so now let's move on to the risk areas that we identified in the health risk assessment. And it's great that Jan already mentioned the 2022 heat waves, more than 60,000 heat-related deaths in Europe, the highest being in Italy, Spain, Germany, France, the UK as well. We do consider them, and Greece. But what the underlying causes, if we look at them, include cardiovascular diseases. They cause around 40% of air pollution-related excess mortality in Europe. And it's not just heat or pollution, it's heat and pollution that we need to consider for policymaking. It's the interaction. If pollution levels are not reduced, the interaction between heat and pollution will further intensify this exposure, especially given the increasing share of elderly population, and then of course combined with increasing underlying health problems. Cardiovascular diseases cost the EU around 282 billion euros per year, with long-term care accounting for about 155 billion euros of this share. Total, that is about 11% of EU health expenditure. Going into the future without proper adaptation, we expect 30,000 additional deaths from extreme heat per year, even under low emissions or low warming scenarios, and up to 90,000 under high risk or high warming scenarios. That is, RCP 8.5, so a catastrophic climate change. Again, Southern Europe is at relatively higher risk. There are several challenges when it comes to heat-related mortality and measuring the impact of climate change on heat-sensitive mortality. And Ian already mentioned this. Different governments, even in Europe, calculate heat-related mortality using a different metric. And unless we come to an agreement or to a standardization sometime very soon, will continue to differ between whether it was 15,000 deaths or 60,000 deaths. And that should not be the case in Europe and the EU. Moving on to vector-borne diseases, increasing temperature, increasing frequency of extreme events such as heat waves and floods and droughts have been accelerating the transmission of various infectious diseases. And these diseases and both the geographical and temporal suitability of several of these infectious diseases have increased in Europe, combined with non-climatic drivers such as travel and tourism, land use and land use change, increasing unplanned urbanization, I would say, socioeconomic factors such as low increase in inequality, and of course human behavior have also influenced the increase in vector-borne diseases in and within Europe. And some of them include West Nile virus, chikungunya that Ian just mentioned, dengue, Lyme diseases, tick-borne diseases, CHF have all either expanded their range or recently emerged in the European Union. And of course, this risk is only going to increase and to severe level under high warming scenario and given the current levels of vulnerability. Future climate change may lead to bacterial pathogen spread and increased AMR. We'll talk a bit more about AMR shortly, which will increase the stress on member state healthcare systems. Climate and land use change could also increase zoonotic spillover, COVID being one of the examples, especially in biodiversity hotspots and areas of high population density, which are increasingly on the rise in Europe. And on to water and foodborne diseases. This is one of the other areas that we highlighted in EUCRA health risk assessment. Campylobacter, giardiasis, hepatitis A are some of the most reported gastrointestinal infectious diseases attributed to contaminated food or water in Europe. Ian mentioned salmonella, and of course, non-cholera vibrio. They have been shown to demonstrate distinct seasonal effects, especially during the warmer seasons. Again, warmer seasons have expanded in Europe, and more frequent and severe flood and droughts increasingly favor the spread of water and foodborne diseases. And some of the areas that we know, but also Scandinavia may be experiencing a doubling of Campylobacter cases by 2080s. For marine bacteria in the Baltic Sea, such as non-cholera vibrio, again, projections indicate an upward trend on these infections during the summer months. So it's a combination of infectious diseases and, of course, water and foodborne diseases that have expanded their temporal and spatial range across Europe. And combined with that, the impact of heat-related mortality, especially on our vulnerable populations, is a recipe for disaster unless urgent actions are taken. An overview of assessment of major risks. So I've shown three, which I thought were the most relevant for this audience, but we identified several other risks in the context of the health cluster. Let's say for the first time, impact on the labor force has been identified as a major risk in Europe. And outdoor workers are especially at high risk, not just from heat-related impacts, but also due to heat-related impacts, many of them are having to work either early in the morning or late in the evening, which increases their exposure to infectious, especially vector-borne diseases such as dengue and malaria. And something especially dengue, something we're looking into in a project that both Ian and I are involved in, not in Europe, but that focuses on Bangladesh. So again, we also identified policy horizon. For example, heat stress, for the general population, the policy horizon is long, but the policy readiness is only medium. And this has to do with the risk ownership, because in Europe, health policies are squarely under the jurisdiction of member state governments. But climate change requires pan-European level risk assessment and policy adjustments. And this tension and this lack of coherence is a major barrier for Europe to address these challenges. But at the same time, if you also look at health systems and infrastructure, towards the end of the century, these issues are expected to become severe. The urgency to act will become severe, but we're nowhere near being policy ready for such issues. Again, we spent a lot of time debating the policy readiness and the time horizons, and I think we did manage to come to something that can influence EU level policy, but also something that can be useful to national governments. Ian mentioned vulnerability and inequality, and this is one of my main areas of research. And large parts of climate change induced health impacts in Europe are due to underlying inequality. I'll end with a question which will make it clear why inequality is such an issue, such a big issue in Europe. Climate change exposes existing vulnerabilities in societies, and Europe is not immune to this. Nearly 2/3 of human and animal pathogens in Europe are climate sensitive, especially in the context of infectious and zoonotic diseases. Even in Europe and in large parts of Europe, the system is not set up to address these diseases. For example, blood supply must be safeguarded against contamination, right, with infectious agents. And if you remember the floods in Germany, several medical facilities, including large hospitals, were shut down for 2 months, more than 2 months in some cases, because they were working on identifying contaminated supplies. Blood banks are at risk from donors returning from countries with endemic tropical diseases, right, which could find suitable climatic conditions in Europe. Non-tropical pathogens such as yellow fever, Japanese encephalitis, and Zika that Ian just mentioned that are currently not endemic, but could remain undetectable until sensitive tests are developed. So even our health systems, our pathological labs will have to will need to be upgraded in order to address increasing challenges from climate change. Heat waves, and as we know, disproportionately affect the elderly, the poor, women, and marginalized individuals with pre-existing medical conditions. Um, Mosquito-borne diseases at the same time, and their outbreaks affect vulnerable communities living near mosquito breeding grounds, and at the same time they lack screens or windows or lack access to repellents. Outdoor workers, I already mentioned, and low-income groups are more exposed due to living conditions or their living conditions, poor health coverage, poor quality of housing stock, and of course their occupational settings. Land use changes causes habitational fragmentation, which increases our contact with natural areas and wildlife. And climate change and AMR that I mentioned briefly before pose significant challenges to public health with far-reaching consequences for health and well-being. 6 million deaths can be attributed to AMR in 2019 and increasing every year. Um, and this is something we identified as a high risk in our storyline on infectious diseases. And Ian played a major role in highlighting this. And the European Commission and the European Parliament, in their reaction to EUCRA, mentioned the challenge of AMR, especially in the context of a changing climate for Europe. So we do hope to see policy actions on these issues in this policy cycle. Role of EU policies before I end. Um, Europe needs to strengthen and invest in the prevention of non-communicable diseases, the prevalence of which is expected to rise in Europe's rapidly aging society. Um, Public health is, again, under the jurisdiction of member states, but climate change induced health impacts are a pan-European issue and will require European-wide policies. We identified this over and over again in our assessment. This results in institutional barriers, which complicate widespread implementation of health policy measures. Right, we will need special planning and building standards. They will be key to reduce um, heat-related health risks. Increasingly, we will need to focus on improving coordination between EU, the member states, and in many cases, subnational regions to enable systematic actions such as new vector and infectious disease control program. And as Ian mentioned, heat health action plans, right, which are still at infancy across most of Europe. And something Ian spent a lot of time highlighting over his career, disease surveillance systems for climate sensitive systems need to be strengthened. And in many parts of Europe, they need to be implemented, right? And even then, the issue of harmonization will remain. And I'll end with a personal but increasingly uh, wide issue that is early warning systems are an effective form of adaptation. Even in Europe, we do not invest enough in such systems that could be key to address many of the climate change induced health issues in and within Europe in the coming years. Um, so, the environment around us is being affected by climate change. So is our personal health, and coordinated action is required to address these challenges. With that, I thank you for your attention.